This is the Group 7 presenting Virginia Henderson Nursing Theory.
A pleasant greetings to all of you. This is Group 7 video presentation. I am Jaya Garvino, the leader of Group 7. Today we are going to discuss the Henderson theory that will be divided to every member of this group. For biography of the theories will be discussed by Ms. Garulaga. The assumption will be taught by Mr. Gomez. For the meta-paradigm will be explained by Ms. Gawan. The 3 levels of nursing-patient relationship will also discussed by Ms. Gilangarin. The analysis and acceptance will be discussed by Ms. Gila. And the 14 components will be presented and discussed by Ms. Gumapak and Ms. Garsota. Lastly, for the case scenario will be demonstrated by Ms. Hyral Gervasio Gervino with the help of other members. These are the flow for our presentation today. Thank you and please enjoy watching.
The Need Theory by Virginia Henderson. Who is Virginia Henderson? Virginia Avenel Henderson was a nurse and also known as the First Lady of Nursing, the Nightingale of Modern Nursing, modern-day Mother of Nursing, and the 20th century Florence Nightingale. Virginia Henderson, born on November 30, 1897, Kansas, Missouri, and she was graduated from Army School of Nursing 1921 and 1932 bachelor's degree, 1934 master's degree in nursing, and she died in March 19, 1996. The Need Theory. The theory focuses on the importance of increasing the patient's independence to hasten their progress in the hospital. Henderson theory emphasizes the basic human needs and how nurse can assist in meeting those needs.
So we will talk about the assumptions of Virginia Henderson's theory of needs, where nurses care for patients until the assurance of the patient to be independent and help the patient's desire to return to health and the willingness to serve the patient wholeheartedly until the patient's full recovery and ready to be independent once again.
Henderson identified 3 levels of nurse-patient relationship. First is substitutive, doing the person or doer, which is the nurse doing something for their patient or the nurse doing or assessed for her patient. The second, supplementary, helping the person or helper, which is the nurse help their patient to become an independent and to increase their health outcomes. Like for example, the nurse help their patient to change her clothes. Third, complementary, working with the person or partner, with the goal of helping the person to become an independent as possible, and the nurse assess the individual in such a way to help him gain independence as rapidly as possible.
Meta-paradigm concepts according to Henderson. The 4 basic meta-paradigm concepts in nursing include individual and environment. Henderson's concepts of a person or individual is made up of 14 basic needs that can be grouped into biological, psychological, sociological, and spiritual components. The physiological component includes Henderson's 1 to 9 needs. Physiological is the 10th and 14th need. Sociological is the 12th and 13th needs, and the spiritual component is the 11th need. A person requires knowledge and strength to perform activities of daily living and have the essentials for survival. The sick or well individual requires help to become healthy, independent, or die peacefully, and there is a connection between mind and body. Henderson's concept of environment includes an individual's relationship with family, community involvement. For example, private and public agencies which provide healthcare and society to help with nursing education. Also, environment can harm a healthy individual through personal factors, such as age, and physical factors, such as air pollution, that can cause illness.
Analysis and acceptance by nursing.
Though Henderson believed that the nursing process is a problem-solving process that could be used to answer the client's needs, the steps involved are not that strange to nursing alone. In the assessment phase, the nurse would assess the 14 fundamental needs of theory. It gathers data by observing, smelling, feeling, and hearing. According to Henderson, planning phase includes giving the plan of care to meet the needs and personality of the client. It must serve as a record and at the same time must fit in the prescribed plan made by the physician. In the implementation phase, the nurse uses the 14 basic needs in answering the factors that are contributing to the illness state of the client. These interventions are focused on maintaining health, to recover from illness, or to aid in peaceful death. In the evaluation phase, the nurse and the client review the relationship and decide whether the goals are met or not. The nurse also assesses if the client attains independence and if health is achieved.
Education. First phase emphasis is made on helping the client perform activities of daily living. Second phase, importance is placed on assisting client achieving their needs in times of marked body disturbance illness. And the third phase is centered on the client and his family together with dynamics affecting relationship inside the unit.
Theory analysis. Virginia Henderson had no intention of formulating a theory, but her definition of nursing, person, health, and environment could still be considered as a grand theory or philosophy in the early days where nursing has not yet fully developed the theories we are using today. Clarity. Concepts used by Henderson are clearly defined and considered.
The patient was being stressed due to failed relationship and the patient experiencing depression. Goal planning. The patient will be able to overcome his stress and depression. The patient is able to reconnect again and socialize to his friends and family. Intervention. The nurse will use herself as a therapeutic for the patient and encourage the patient to be motivated for his life.
Hi sir, how are you sir?
Nurse, I don't know if I'm going to make it.
Number 10. Communicate with others and expressing needs, fears, or opinions. Assessment. The patient feels hopeless because of the problem that came into his life. Goals. The patient will become free to express his feelings, needs, fears, and opinion. Intervention. The nurse will educate the patient's family of the importance of mental and emotional health for the patient's fast recovery.
Hi sir, how are you sir?
Nurse, I don't know if I'm going to make it.
Sir, laban lang sir ha. Okay na yung examination. Don't you worry. You need to relax and fight lang.
You need to motivate yourself.
You need to motivate yourself, sir, araw-araw to feel comfortable.
11. Worship according to one's faith. Assessment. The patient's religion is Christian and he is very religious and very active on church gatherings. Goals. The patient will feel that there is no judgment and discrimination to his beliefs. Intervention. The nurse will respect the patient's beliefs and also the nurse can provide Bibles for the patient.
Sir, kailangan ni mo manalig para kailangan ni mo fight, kailangan mo mag-pray para tagaan pa ka og taas nga kinabuhi. Always lang jud mag-pray.
Number 12. Work in such a way that there is a sense of accomplishment. Assessment. The patient was not able to do the things he wants to achieve due to his injuries. Goals. The patient can help himself by admitting and recognizing his strengths and shortcomings as well as supporting him in setting goals, making decisions, and evaluating the efficiency of his coping mechanism.
sir, ma'am. Okay na ang tanan, okay na ang lab examination. Always lang, i-maintain ang treatment o permintilyumpiuhan ang wounds. Every month is, kailangan nyo mabalik sa hospital to have a follow-up check-up, and that's all. Thank you.
Number 13. Play or participate in various forms of recreation. Assessment. The patient is undergoing physical therapy for her adrenaline's mobility. Goals. The patient will engage to community exercise and social interaction. Intervention. The nurse will spend quality time with the patient and provide soft comfort so that they do not feel lonely and bored.
Sir, good morning, sir. Kumusta na? Kumusta yung pamati?
I am fine now.
Nakaingi na ka, sir? Nakalibang na ka?
Yes.
So, unsay mong ginabating na karon, sir?
I think I can go now.
Congrats, sir. You can go home na.
Number 14. Learn, discover, or satisfy the curiosity that leads to normal development and health, and use the available health facilities. Assessment. The patient is impulsive and emotional as a result of her current situation, which has an impact on her physical and mental health. Goals. The patient must recognize the issue, have faith in himself and his abilities to deal with it, as well as identify her social support system and potential source of hope. Intervention. The nurse will provide physical and mental care that the patient's abilities, while also encouraging the patient's family, hope and love and show care.
Ma'am, kailangan nimo maging aware sa mental health sa patient. O naman may problema dalawa, ipagpaliban na lang sa para it help to recover sa patient ba? Okay. Okay.
Assess if the client attain independence and if health is achieved.
Education. First phase emphasis is made on helping the client perform activities of daily living. Second phase, importance is placed on assisting client achieving their needs in times of marked body disturbance illness. And the third phase is centered on the client and his family together with dynamics affecting relationship inside the unit.
Theory analysis. Virginia Henderson had no intention of formulating a theory, but her definition of nursing, person, health, and environment could still be considered as a grand theory or philosophy in the early days where nursing has not yet fully developed the theories we are using today. Clarity. Concepts used by Henderson are clearly defined and consistent with one another as outlined in 14 basic human needs, which are stated in a straightforward and direct manner, although her theory has no structural form or diagram. Simplicity. Henderson's concept of nursing is complex rather than simplistic. Many variables and several descriptive interpretations could be derived and other explanatory relationships could be seen. Generality. The definitions provided by Henderson are broad in scope. They work in such a way that they cover all areas of nursing practice and could be applied in every setting. Accessibility. Henderson's theory is used in practice and the concepts are clinically significant as they focused on assisting individuals to gain independence in relationship to the performance of activities contributing to health or its recovery.
The case study. The patient, Mr. Gomez, 30 years old, live in Barangay Kalumpang, General Santos City, who has recently been admitted to the hospital after falling down the stairs and breaking his ankle. His ankle has been repaired with an open reductions and fixations device currently. He is unable to bear weight on the extremity. Physical therapy is working with Mr. Gomez to assist his advancing his mobility. The nurse found out that he's been experiencing muscle weaknesses in his legs for the last 2 months, and he has a history of scoliosis and believed the weaknesses was due to alignment problem. Upon admission, Mr. Gomez has lateral weakness in his lower legs. You are unable to access his gait due to fractured ankle, but he states he has been unsteady on his feet for the last few weeks. Upon further history taking, you find out his appetite has diminished over the last 3 weeks. He states he is hungry, but when he tries to eat, he gets fatigued easily, then quickly loses his appetite. He has lost 10 pounds in the few months and now weighs 120 lbs. Her CBC and CMP are within normal limits with the exceptions of mild anemia with an H&H of 11.5 and 32.9. Testing is currently being undertaken for a definitive diagnosis of weaknesses that lead to Mr. Gomez's fall. He has 3 children, all girls. His religious preference is Christian. His family of origin practices Christianity. Mr. Gomez has been married 5 years to her second wife and states they have a good relationship, but that they have not been intimate for 2 months because he has not been feeling well. Mr. Gomez was married to his first wife for 12 years. That marriage ended in divorce after he discovered his first wife was lesbian. When the nurse entered Miss Gomez's room to discuss the plan for the shift and day, the nurse observed Mr. Gomez's affect to be sad. Number 1 for the 14 components, breath normally. Assessment findings: the patient is experiencing shortness or breath and irregular heartbeats due to massive injury, and he stated that he has history of anemia. Goal planning: the patient is able to breathe normally without oxygen tank as long as he can breathe properly. Nursing intervention: the nurse will provide the following: oxygen tank if needed. The nurse will help the patient to practice properly breathing to improve his breathing capacity. The nurse will help the patient to execute breath exercises for the patient.
Let's move again your body, sir, to upward. Are you comfortable with the sir?
Yes.
Let's practice your breathing, sir. Inhale. Exhale. Inhale. Exhale. Are you good, sir?
Yes.
Number 2, eat and drink adequately. Assessment findings: the patient stated that he is hungry, but when he tries to eat, he quickly loses his appetite and feels fatigued. Goal and planning: the patient will eat proper and healthy meals and drink exact amount of water to stay dehydrated. Nursing intervention: the nurse will provide the following. The nurse will educate the patients about on what is the importance of healthy eating for his fast recovery.
Sir, ma'am, I remind you that your husband needs to eat healthy foods and to take his medicine after he eats. Okay.
Number 3, eliminate body waste.